This is Unimed TV. I'm Miss Comfort Oguniro and I'm your host for today. I have a guest here with me. Can you please introduce yourself, sir?
Good morning,
Yes, sir.
the world. Good morning, Nigerians. Good morning, Ondo. Unimed. My name is Dr. Angela Jesu, and I'm glad to be here.
Thank you very much for honoring our invite, sir. So there has been this noise in Unimed community about a certain World Oral Health Day happening. Can you please shed more light on that?
Thank you very much. World Oral Health Day is a day that is designated all over the world. It's a global event. We campaign this every year at a specific day, 28th of March, every year, to create awareness and also to unite the world on the importance of oral health awareness in the populace.
Okay. Thank you very much, sir.
Thank you.
So when I hear oral health, I'm trying to understand much more what exactly is oral health about in a layman term.
In a layman term, oral health is just when you say, health of the oral environment, health of your teeth, health of your gums, and then health of all other orofacial systems. Your cheek, your throat, your face, every other thing. That is what it's talking about. And also what to do to actually ensure that you practice a very good oral hygiene, keep your mouth clean, keep your teeth active, clean all the time, and also to do some preventive measures, the one you do at home, brushing properly every time, and also to prevent any invading pathogens affecting your oral environment in terms of infections, oral ulcers, and so on and so forth, caries, holes in your tooth, and so on and so forth.
Okay, thank you very much, sir. That was a very elaborate explanation. So I would also like to find out what are some of the common oral health problems?
Yeah, there are a lot of them. There is this common one that, you'll be hearing, I have hole in my teeth, which we call cavities. Many people complain about gum pains, gum bleedings.
Also, gum bleeding is not normal?
Yes.
Oh, wow.
It's not normal.
Okay.
You are not meant to have bleeding in your gums.
Okay.
And also we have a lot of them, shifting of teeth. It's very common even at a very early age, old age, middle age, is very common. And also oral ulcers, oral cancers.
So wait, we can have oral cancers, like cancer in the mouth, involving the face?
Yes.
Okay.
In fact, oral cancers is very common. Very, very common. Let me give you an example. In our clinic, Unimed here, for the past 3 months, we have, out of 10 patients invariably, we've had nothing less than 4 patients with oral cancers.
Wow.
And the tragedy of these oral cancers is the fact that they don't present on time. And patients come whenever it is already late. They present late, so it makes the prevalence to be very, very high, especially in this our environment.
Wow.
I'll be talking about the cause of these oral cancers as we go on. There are a lot of local causes that we human beings, the populate, the underserved environments, the communities, they don't pay attention to, and they do them almost every day.
All right. Thank you very much. So I have some questions from the public that I would like you to address.
All right.
Okay, so the first question, if my tooth is paining me, can I put ogogoro, can I put atari, can I put cow urine?
To supplement to what I said earlier, I said oral cancers can be caused by a lot of local things that we do, that our people do out there. Now, you have toothache. I want to put ogogoro. In fact, some people go to the length of telling me or telling the health professionals that, somebody told me in the household to use alabukun water to use aspirin water, to use, in fact, they go to the length of using battery water.
I've heard that.
These are the common causes of oral cancers. And apart from that, from chemical burns and so on and so forth, you open some people's mouth and you have a lot of burns in their mouth, on their tongue, floor of the tongue, their cheek, palates, everywhere.
And it's because of these substances.
And you know, our people, dental awareness is very poor. So they use anything until it has gone to the later stage before they present themselves. So when you have toothache, you don't use those things. You come to the nearest dental clinic.
Okay.
And let us examine you. Let us tell you what is going on in your mouth. And toothache can be, it has different levels, different grades. And once you come, we just examine you, we tell you what to do, and you'll be fine.
Okay.
Other than using local things that are not quantified, not certified by any medical societies. And once you are doing that, you are abusing drugs. And you are going to have problems.
Wow. Thank you very much for that answer. So the second question is it possible for an adult to have a milk tooth in their mouth? Very
possible. In fact, it's very common.
Oh,
yes.
Okay.
That is what we call retained primary tooth. It's very common. There are different reasons why it can be there.
Okay.
Some people may not even have their permanent tooth, their adult tooth. And what do you expect? The milk tooth will still be there.
Will still be there.
Because it is the permanent tooth that pushes the milk tooth outside. As long as it is congenitally missing, which is what we call it medical terms,
okay,
then it can be there. And also, if the permanent tooth is coming out at a very wrong place, it's not coming out at the proper place, it should come out, then you expect the milk tooth to still be there. Then the milk tooth will be there, you know, very close to the permanent tooth. So it's possible, very possible, it's very common nowadays. It's very common to have a milk tooth. And once you have something like that, then we'll tell you whether it is needed to be removed or you just have to let it be.
But it's important that we first of all still come to the
clinic.
Yes,
you have to come because we are the one that understand why it is there and what needs to be done.
Okay. Thank you very much.
Thank you.
Okay, so my next question is this. Now, can we use our teeth to open Coke bottle, Fanta bottle, you know, just want to quickly buy cold minerals?
You know, in the old days,
okay,
people use their teeth to do anything.
Yes.
And they suffer for it. But with the advent of science, we begin to know that these things are not good. Because over the years back, you will realize that even young age of 15, 20, 25, middle ages, they lose their teeth. You know, like, what happened to your teeth? They will not be able to tell you. But when you press them, they will tell you, I've been using my teeth to open bottle, to crack bones, do wrong practices. So as a result of that, it's not good. One thing that can happen is, number one, you may have fractured teeth. Your teeth can break.
Okay.
And once that teeth is broken, it's fractured, then you have pains and you have problems and you may end up losing that tooth. Just as a result of the fact that you use your teeth to open bottle. Our teeth are not designed to open bottle. They are designed to chew, to eat. So opening bottles with your teeth is a wrong practice. It is very wrong and it has to stop.
I hope we have all heard Dr. Angela. When we want to go and buy, please quickly give me one cold minerals, quickly give me one cold Sprite there. Our teeth, as he has said, is not for opening Coke bottles, it's not for opening Fanta bottles. Let us just get an opener, a proper instrument to open our bottles. Thank you. Okay, so I also want to ask, Does hard toothbrush clean the teeth better? It just makes sense that something that is hard, you should be able to clean well, right?
It doesn't clean anything better.
But you know it's hard, like it should clean very well now.
You know, there is something we call people that use hard toothbrush. We call them smokers.
Okay.
Okay?
Yes.
You know, smokers, they believe the stains in their teeth from the smoking cigarettes, from all the pigments from the smoking cigarettes, will not actually allow their teeth to clean. So they prefer to go out there and go and buy hard toothbrush and begin to, it destroys their teeth more. But in a layman language, they used to call it smokers toothbrush. It is very wrong to be using hard toothbrush.
Okay.
What we prescribe, what we recommended is medium textured toothbrush. You don't actually need too hard of a brush before you can clean your mouth. Okay. There are different techniques that you will apply to clean your mouth without using hard toothbrush. Hard toothbrush only destroy the tooth structures and also destroy your gums. Now, there are different, tooth wear lesions.
Okay.
Lesions on the teeth that are caused by hard toothbrush. Okay? Gingival recession, are you getting me? They are majorly caused by toothbrush. Or the root of your teeth were exposed. Are you getting me?
Yeah.
And at the end of the day, you'll be having serious sensitivity on your teeth.
Okay.
So hard toothbrush does not actually do any good to your teeth. It only destroys the tooth and also destroys the gums.
Okay.
So what we recommend to all our people out there, all over the world, universally accepted method and toothbrush of brushing is the medium texture toothbrush. And you brush lower teeth up while you brush upper teeth down. Okay. Then when you finish that, you brush inside your teeth, inside your mouth, then you brush your tongue. Okay. So there are techniques to brush with the use of medium texture. Medium texture is not hard and it's not too soft. Okay. It is suitable for your tooth to clean your teeth without destroying your teeth and without destroying your gums. Okay.
Dr. Angela, can I ask a question still on that? How am I going to know which one is hard, which one is medium? How am I supposed to know?
Yes. Some industries or some companies who produce all these things actually used to write it on them.
That's interesting because if once go and buy toothbrush,
and if you are confused,
just say, give me toothbrush.
You can actually ask them in the supermarket or pharmacy that you need a medium texture toothbrush.
We'll just go there, we'll just say, I want
and
to buy
most
brush.
Of the ones I've seen so far, they will write it there. Medium, hard, soft.
Okay. So we're supposed to be looking out for it.
Medium, yes.
Wow. So I believe we have all heard. The next time you are going to go and buy toothbrush, please read it very well. Is it hard? Is it medium? Also, still on this discussion on toothbrush, I want to ask, is it bad if a person is using a toothbrush like over 1 year, 2 years? Because I feel like everybody forgets to change their toothbrush.
There is something we call foreign body impaction on the gums. Okay. What I mean is that, what we are using to brush our teeth is called foreign body.
Okay.
So you get, they are foreign body as far as we are not swallowing them, and as far as we are not using them, it's not staying inside our mouth or inside our body. So this toothbrush is made of filaments. Okay. Okay. And tufts of filaments. Okay. What happens is the nature of your teeth and the duration of this toothbrush varies. What I mean is that, for example, you can use a toothbrush and you already notice that after 3 months it's already bending.
We still like it like that.
And some people will still continue using it. At that stage, it's not doing any work.
Wow.
Yes. Because it has already bent. You need to change it. Some people can use toothbrush for 6 months and it has not bent. Once you realize that the top part is already bending, then you change it. There is no need to be using one toothbrush for a year. No. Once it is bent, then you change it. Even if it is just 2 months, once it is bent, you change it. But we used to tell our patient that at least every 3 months. Yes, on average, you should have changed your toothbrush.
Wow. Thank you very much. So every 3 months, we are supposed to change our toothbrush, as he has said. So someone says that I have heard that if I come to the dentist and I remove a tooth, that they'll just start removing the remaining tooths. I'll just keep on coming. Can you shed more light on that, sir?
That is not true. Okay. You know, people get their own knowledge from what they hear from outside. The outsiders, the household, friends, well-wishers, they have their own knowledge about dentists, about your teeth, about how your treatment should go, which is very wrong. So many people learn the wrong things from outside. It is people that are advising them. Reason why they must not go to the dentist. They are the people that are telling them all those lies. They are all lies. Okay? So when you come to dentist, we know what to do. And that when you remove a tooth, you keep on removing teeth is very, very wrong. Because I used to laugh whenever I hear it. I said, why will you say something like that?
They don't just like us dentists, if you just like removing.
Are you getting me? So it is people that are selling drugs. Are you getting me? They want to make their money from medications they are selling to patients not to come to clinic. They are the ones confusing them. They are the ones telling them all those lies so that they will not have any reason to come to the clinic. But at the end of the day, they have themselves to be blamed because the clinics, the doctors, the dentists you don't want to come and meet, you will see end up at their desk.
Wow. Okay. Now, just layering on that, I have heard of times where people have issues with their mouth, their teeth, and still would not want to come to the dentist, but they still maybe just look for someone by the roadside to, we'll still call that presentation of it. They still present to the person. What do you think about that?
You see, like the theme for this year's World Oral Health. Okay. It says, your happy mouth is a happy body. You see, when you toy with your health, with your mouth, with a road-sided person who is not saddled with the responsibility as a professional to take care of your teeth, then you are doomed. See, I've seen a situation whereby we've lost patients on the basis of going to the roadside to meet a quack who doesn't know anything about what is happening in your mouth. Number one, the instrument they use, you don't know how it came up on board, whether it is sterilized or not, and even the person that you are actually there to meet, you don't even know who he is.
Maybe it's referral.
And there are different diseases out there.
Okay.
Hepatitis B, which is the most contagious diseases, infectious diseases in the world. We have HIV there. These things can be contracted from unsterilized instruments. And the instrument they use for one person, there is high possibility that they will use it for you.
Wow, that's true.
And at the end of the day, we have recorded a lot of people that they had treatment done from a road-sided people who are not saddled, who are not professionals, and they end up with different problems. They end up with blown out infections, orofacial infections, and every other thing that I cannot begin to mention here. So at the end of the day, they will come back to the clinic eventually, at the late stage, even at the moribund stage.
Wow.
And at the end of the day, they will expect us to perform magic.
Your saviors. Wow. Thank you very much. Okay, so the next question. When I brush, I bleed. That is normal, right?
It's not normal.
It's not?
It's not normal. You are not meant to bleed whenever you brush. It's not normal. There are different reasons why you can bleed from brushing. Number one, if your gums are dirty. If your teeth are dirty and your gums are dirty, there is high possibility of you bleeding while brushing. Okay. And apart from that, there are some systemic diseases, okay, that can affect your gums.
Thank you, sir.
Like I told you earlier on, there are different diseases in the body that can be detected from your mouth. Let me just give you an example. Hypertension.
Okay.
The common hypertension.
Okay.
It can be detected from your mouth.
Wow.
And in that case, if you have hypertension and you have not been taking care of your teeth, you have not been coming to clinic, to us, so that we can help you to professionally wash your teeth, all these deposits will stay inside your gum, and it will continue to irritate your gums, and before you know it, you begin to have bleeding whenever you brush, because the blood flow to your gums are being compromised.
Wow.
Because all these tartar that are attached to your teeth, stored inside your gums, they are all local infections, competing with the healthy state of your gums. So whenever you brush in that aspect, you have bleed.
Wow, thank you very much. So I believe we've all taken note that bleeding gums are not in any way normal. Bleeding gums are not in any way normal. All right. So someone says, nothing is wrong with me. I mean, I don't think anything is wrong with me. Must I still come and visit the dentist?
You know, like they say, prevention is better than cure. But in this part of the world, we don't put prevention as our priority. Okay? We wait until the late stage before we present ourselves. In fact, the moment you give birth to a child and the child starts bringing out tooth, immediately you must start bringing that child to visit a dentist.
Wow, so since...
Yes.
Wow, thank you.
There are many diseases, there are many conditions in your mouth that it will not give you, it will not sensitize you. And they are already there. But you will not know. You will think you are fine. But when you come to the clinic, we will just look at it and say, oh, this is going on, this is going on. You have to do this, you have to do that. So it
takes the eyes of a professional.
Yes. But our people, they believe it's until when they have pains before they present. Okay, for example, somebody that discovered that whenever he or she brushes, or whenever he or she, look into the mirror, he discovered there is a hole. And he didn't come because it's not giving him or her pains. And if he has presented him or herself earlier on, we will have just done something on it and fill it up. And you continue to use your tooth forever. But people come whenever they have pains, when the thing has already gone haywire. And they will, most of them end up losing their teeth.
Oh. Okay, since you brought up this discussion about a hole in a person's tooth, I just want to ask and further clarify what can be done for someone who has a hole in their tooth.
For someone who has a hole in his or her tooth, that hole can be filled. We have different types of filling materials.
Okay.
We have different types of treatment procedures that can be done on a tooth. Okay, it may be simple filling or extensive filling. And you'll be using your tooth as long as it takes.
Oh, okay. But it usually sounds to us in the public that what dentists do is to remove.
That is public opinion.
Okay.
It is never true.
Okay.
Removal of a tooth is the last resort. There is no dentist that likes removing a tooth. We would like to preserve the tooth. But if the only solution to the oral health of the patient is to get the tooth out, then we'll explain the details to the patient.
Okay. Thank you very much for that clarification. So I think within this interview, I've been hearing you say something about, the clinic here, the clinic here. So there is a dental clinic in Unimed THC.
Yeah, this is a teaching hospital.
Okay.
Well equipped with standardized professionals, saddled with the responsibility of taking care of different parts of the body as a whole, in which the mouth is one of them. So we are dentists that are working here in Unimed, and we have, our clinic is here where patients come on regular basis to have, dental checkup done, and also to have different treatment done, to have surgery done. So in Unimed here we have dental clinic, dental centers with different departments saddled to ensure that your oral health is optimum.
Okay. So what services are usually offered in the dental clinic? I think what the public basically is aware about is dentist remove.
Yes. Your mouth, the health of your mouth is the health of your body. That is why they said a happy mouth is a happy body. And don't forget, like they say, that you are what you eat. So we are here in Unimed, Laje, Ondo, to take care of you as a whole. And we have different types of treatment that we do for our patients, as low as scaling and polishing that people call out they want to wash their teeth. You can be using brush every day, but there are still some deposits on your teeth. It's not enough. There are different deposits on your teeth, which we call tartar, or we call it professionally plaques and calculuses.
So my brush is not enough to remove it. It's not enough.
As long as you produce saliva in your mouth, a lot of things can form. It's bound to be there. And you are meant to be visiting us every 6 months to have your teeth cleaned professionally.
Every 6 months. That's twice a year.
That is number one. Then we do fillings. There are different types of fillings, minor fillings, extensive fillings, that we do to preserve people's teeth. Then we have a lot of people we have a lot of tumors of the jaws, of the face. Like I said earlier on, a lot of squamous cell carcinomas, a lot of cancers of the faces, of the mouth, of the tongue, and the rest. We treat all that as long as taking the patient into theater to have tumors removed, to do jaw reconstructions, taking bones from part of the body, using plates to reconstruct the face, to restore functions and the form of the faces. So it is not about you coming to have your teeth cleaned, or to have your teeth filled, or to have your teeth removed. There are a lot of extensive advanced surgeries that we do as far as you have a face and you have a neck.
Okay, thank you very much, sir, for letting us know the services that are being offered in Unimed THC. So with your final words, I just want you to speak to this matter. I hear that the public are usually afraid of dentists. Maybe dentists are their enemy, dentists are the ones that would bring them the greatest pain. they've heard of maybe injection, instruments, different things. So can you just please calm the public down and let them know that
Nigerians, I want you to understand one beautiful thing. That this program of World Oral Health Day is designed, is separated out of every day in a year, which is the 28th of March every year, to celebrate you, to celebrate your mouth, to celebrate your health. So if this day is coined out all over the world to celebrate you, then you have no reason not to celebrate yourself. Now, you need to assist us so that we can assist you. If you don't assist us by coming to us, we are lovely people, we are very friendly, accessible. In fact, we always love you to smile, and we love your smile. You can't do that when you're at home or when you're afraid to calm down. When you calm down, then we'll be able to actually restore your esteem. Whether you have low self-esteem before, we'll help you to restore it. If you have a very bad breath before, we help you to restore it. If you have a very bad smile before, we help you to restore your smile. If you have potential diseases in your jaw, in your mouth, in your face that can actually prevent you from living long, we'll help you to solve it. You can't stay at home and be expecting miracle to happen. Also, I would like to bring to the notice of the populace in Ondo town specifically, that this program, we have visited a lot of places. We have visited Bolorunduro, we have visited Ileology, we have visited some other places. In fact, we have visited almost ahead of the market visit too. So as to create awareness that their oral health is very, very paramount. And we've already told them what to do whenever they have people, some of them that will be able to isolate 1 or 2 cases that have dental issues, oral mouth issues. We have told them to calm down. In fact, we've been seeing them since yesterday, and we were so happy to have them around. And I could say that their response, their impressions back home is going to actually change a lot of things. So we still expect you people to come down here to let us see you and to be part of the program. Here in Unimed Dental Center, Laje, Ondo. Thank you very much.
Thank you very much. It has been an enlightening session with Dr. Angela here today. I have picked my own point, and I hope that you that is hearing this has also picked your own point. Thank you very much again, Dr. Angela, for gracing us with your presence.
And don't forget that a happy mouth
is a happy body. Thank you very much.